Question 1. A nurse is caring for a client with a new prescription for warfarin. Which food should the nurse instruct the client to consume in consistent amounts? A. Spinach. B. Beef. C. Oranges. D. White bread. Answer: A. Spinach. This question tests your knowledge of dietary considerations for clients on anticoagulants, specifically warfarin. The keyword consistent amounts is crucial because warfarin's effect is highly influenced by vitamin K intake, which is abundant in green leafy vegetables like spinach. Maintaining a consistent intake of vitamin K-rich foods helps prevent fluctuations in the client's INR, International Normalized Ratio, which measures how long it takes for blood to clot. For example, sudden increases in vitamin K can reduce warfarin's effectiveness, increasing clotting risk, while decreases can heighten bleeding risk. Always remember that consistency, not avoidance, is key when managing dietary vitamin K with warfarin. Question 2. A nurse is assessing a client who reports experiencing shortness of breath. The client's vital signs are BP 148/92 mmHg, HR 104 BPM, RR 28 breath/min, SpO2 88% on room air. Which action should the nurse prioritize? A. Administer a prescribed as needed bronchodilator. B. Place the client in a high Fowler's position. C. Notify the primary healthcare provider. D. Apply oxygen via nasal cannula. Answer: D. Apply oxygen via nasal cannula. This question evaluates your ability to prioritize nursing actions based on immediate client needs, especially when dealing with respiratory distress. The most critical clue is the SpO2 of 88% on room air, indicating significant hypoxemia, which is a life-threatening condition. Applying oxygen is the immediate and most crucial intervention to improve oxygen saturation and alleviate the client's shortness of breath before considering other actions like bronchodilators or provider notification. Think of the ABCs: airway, breathing, circulation. Ensuring adequate breathing by providing oxygen is always a top priority. Question 3. A nurse is preparing to administer an intramuscular injection to an adult client. Which needle gauge and length is most appropriate for this administration? A. 25 gauge, 5/8 inch. B. 22 gauge, 1 inch. C. 20 gauge, 1/5 inches. D. 18 gauge, 1 inch. Answer: C. 20 gauge, 1/5 inches. This question assesses your understanding of proper intramuscular injection techniques, specifically needle selection for an adult. The keywords intramuscular injection and adult client are important because IM injections require a needle long enough to reach the muscle tissue and a gauge that allows for adequate medication flow without causing excessive pain. A 20 gauge, 1/5 inch needle is generally appropriate for IM injections in an adult, ensuring the medication is deposited deep into the muscle, such as the deltoid or ventrogluteal site. Remember that the gauge number is inversely related to the needle's diameter, meaning a smaller gauge number indicates a larger needle diameter. Question 4. A nurse is caring for a client with a history of heart failure who presents with sudden weight gain and peripheral edema. Which dietary instruction should the nurse reinforce? A. Increase fluid intake to 3 to 4 liters per day. B. Limit sodium intake to 2 grams per day. C. Consume high potassium foods daily. D. Increase protein intake to support muscle mass. Answer: B. Limit sodium intake to 2 grams per day. This question tests your knowledge of dietary management for clients with heart failure. The key clues are sudden weight gain and peripheral edema, which are classic signs of fluid retention, often exacerbated by excessive sodium intake in heart failure. Limiting sodium intake is crucial because sodium causes the body to retain water, worsening fluid overload and symptoms like edema and shortness of breath. For example, instructing the client to avoid processed foods, canned soups, and cured meats will significantly help manage their fluid balance. Always remember that sodium restriction is a cornerstone of managing heart failure symptoms. Question 5. A nurse is educating a client about new colostomy care. Which statement by the client indicates a need for further teaching? A. I should empty my colostomy bag when it is about 1/3 full. B. I can eat whatever I want now that I have a colostomy. C. I will clean around the stoma with warm water and mild soap. D. I need to check the skin around the stoma for any irritation or redness. Answer. B. I can eat whatever I want now that I have a colostomy. This question assesses your ability to identify misconceptions in client education, particularly regarding colostomy care. The statement, I can eat whatever I want now that I have a colostomy, indicates a need for further teaching because clients with colostomies often need to adjust their diet to manage output consistency, avoid gas, and prevent blockages. While many foods can be reintroduced, it's typically done gradually, and some foods might continue to cause issues. For example, high-fiber foods should be introduced cautiously, and certain foods like popcorn or nuts might need to be limited to prevent blockages. Always emphasize that dietary adjustments are often necessary for optimal colostomy management. Question 6. A nurse is caring for a client who is receiving a continuous intravenous infusion of heparin. The nurse should anticipate administering which medication if the client experiences bleeding? A. Vitamin K. B. Protamine sulfate. C. Warfarin. D. Enoxaparin. Answer. B. Protamine sulfate. This question tests your understanding of antidote medications, specifically for heparin. The keyword heparin and the scenario of bleeding are crucial clues. Protamine sulfate is the specific antidote used to reverse the anticoagulant effects of heparin, including low molecular weight heparins like enoxaparin. It works by forming a stable salt with heparin, neutralizing its anticoagulant activity. For example, if a client on heparin develops a nosebleed that won't stop, protamine sulfate might be given to quickly reverse the medication's effects. Remember that knowing the specific antidotes for common medications is essential for client safety. Question 7. A nurse is assessing a client who has a deep vein thrombosis, DVT, in the left leg. Which finding would be most concerning to the nurse? A. Unilateral leg swelling and pain. B. Redness and warmth over the affected area. C. Shortness of breath and chest pain. D. Positive Homan sign. Answer. C. Shortness of breath and chest pain. This question evaluates your ability to identify life-threatening complications of deep vein thrombosis, DVT. While unilateral leg swelling, pain, redness, and warmth are signs of a DVT, shortness of breath and chest pain are critical clues indicating a potential pulmonary embolism, which occurs when a blood clot from the DVT travels to the lungs. A PE is a medical emergency and can be fatal, making it the most concerning finding. Always prioritize assessing for signs of PE in clients with DVT, as it requires immediate intervention. Question 8. A nurse is providing discharge teaching to a client with newly diagnosed type 2 diabetes mellitus. Which statement by the client indicates effective teaching regarding foot care? A. I should soak my feet daily in warm water with Epsom salts. B. I will wear open-toed sandals around the house to prevent sweating. C. I will check my feet daily for any cuts, sores, or blisters. D. I should trim my toenails by rounding the corners. Answer. C. I will check my feet daily for any cuts, sores, or blisters. This question assesses your knowledge of essential foot care for clients with diabetes, which is crucial due to impaired circulation and neuropathy. The keyword effective teaching means you're looking for the correct and most important preventative action. Daily foot checks are vital because clients with diabetes may not feel minor injuries due to neuropathy, and these injuries can quickly become infected and lead to serious complications. For example, a small blister unnoticed could progress to a non-healing ulcer. Always emphasize daily inspection and proper footwear as cornerstones of diabetic foot care. Question 9. A nurse is caring for a client with a nasogastric NG tube for gastric decompression. Which assessment finding indicates the NG tube is functioning effectively? A. The client reports increased abdominal distension. B. The client's bowel sounds are hyperactive. C. There is a decrease in gastric output. D. The client reports relief from nausea and vomiting. Answer: D. The client reports relief from nausea and vomiting. This question tests your understanding of the therapeutic goals of nasogastric tube decompression. The key phrase, functioning effectively, refers to whether the tube is achieving its intended purpose. The primary goal of gastric decompression is to remove gastric contents, thereby relieving pressure, distension, and associated symptoms like nausea and vomiting. Therefore, the client reporting relief from these symptoms is the most direct indicator that the tube is effectively decompressing the stomach. While gastric output might decrease once the stomach is emptied and bowel sounds might change, symptom relief is the most significant sign of effectiveness for the client. Question 10. A nurse is preparing to administer medications through a percutaneous endoscopic gastrostomy (PG) tube. Which action should the nurse take first? A. Mix all medications together to administer at once. B. Crush all tablets to a fine powder. C. Flush the PEG tube with water before and after medication administration. D. Administer medications rapidly to prevent clogging. Answer: C. Flush the PEG tube with water before and after medication administration. This question assesses your understanding of safe medication administration via a feeding tube, specifically a PEG tube. The keyword "first" indicates a priority action. Flushing the tube with water before administering medications ensures tube patency and prevents interactions between previous enteral feedings and new medications. Flushing after administration ensures all medication clears the tube and reaches the client, while also preventing tube clogging. For example, if you don't flush first, residual formula could interact with the medication or clog the tube, preventing proper delivery. Always remember that flushing is a critical step for maintaining tube patency and ensuring accurate medication delivery. Question 11. A nurse is caring for a client who is actively bleeding from a large laceration. Which nursing intervention should the nurse prioritize? A. Apply direct pressure to the wound. B. Elevate the affected extremity. C. Obtain a detailed client history. D. Prepare for intravenous fluid administration. Answer: A. Apply direct pressure to the wound. This question tests your ability to prioritize immediate interventions for an actively bleeding client. The critical phrase, actively bleeding from a large laceration, indicates a life-threatening situation where immediate action is required to control blood loss. Applying direct pressure to the wound is the most rapid and effective initial intervention to stem external bleeding and should be done before any other actions. While elevating the extremity, preparing for fluids, and obtaining history are also important, stopping the bleeding is the absolute first priority in this emergency. Remember your ABCs: airway, breathing, circulation, and controlling hemorrhage falls under circulation. Question 12. A nurse is providing education to a group of clients about reducing the risk of osteoporosis. Which instruction should the nurse include? A. Increase intake of carbonated beverages. B. Engage in regular weight-bearing exercises. C. Limit exposure to sunlight. D. Avoid dairy products. Answer: B. Engage in regular weight-bearing exercises. This question assesses your knowledge of preventative measures for osteoporosis. The concept being tested is bone health and its maintenance. Weight-bearing exercises are crucial because they stimulate bone formation and help maintain bone density, directly counteracting bone loss associated with osteoporosis. For example, walking, jogging, and dancing are excellent forms of weight-bearing exercise that help strengthen bones. Remember that bones respond to stress by becoming stronger, making these exercises vital for bone health. Question 13. A nurse is assessing a client who underwent a total hip arthroplasty yesterday. Which finding is most concerning and requires immediate intervention? A. Client reports 4/10 pain controlled with oral analgesics. B. Serosanguineous drainage noted on the dressing. C. Absence of pedal pulses in the operative leg. D. Client is able to ambulate with assistance. Answer: C. Absence of pedal pulses in the operative leg. This question assesses your ability to identify critical postoperative complications following a total hip arthroplasty. The keyword, most concerning, directs you to a finding that indicates a severe and potentially limb-threatening issue. An absence of pedal pulses in the operative leg suggests a compromised vascular supply, which could lead to ischemia and tissue damage if not addressed immediately. While pain, drainage, and ambulation are important assessments, a lack of blood flow is an urgent vascular emergency. Always prioritize circulation issues in postoperative clients. Question 14. A nurse is reinforcing teaching with a client who has iron deficiency anemia. Which food choice indicates the client understands how to improve iron absorption? A. Milk. B. Black coffee. C. Orange juice. D. Whole grain bread. Answer: C. Orange juice. This question tests your understanding of factors that enhance iron absorption in clients with iron deficiency anemia. The keyword, improve iron absorption, is key. Vitamin C, ascorbic acid, significantly enhances the absorption of non-heme iron, iron from plant sources, and fortified foods. Orange juice is a rich source of vitamin C. For example, advising the client to take their iron supplement with a glass of orange juice or to eat iron-rich foods with vitamin C-rich fruits and vegetables will maximize absorption. Remember that vitamin C is a powerful helper when it comes to absorbing iron. Question 15. A nurse is preparing to administer intravenous potassium chloride to a client with hypokalemia. Which action is essential for the nurse to take? A. Administer as an intravenous push over 1 minute. B. Infuse at a rate no faster than 10 milliequivalent/hour. C. Administer via gravity infusion without a pump. D. Dilute in a minimum of 50 milliliters of solution. Answer: B. Infuse at a rate no faster than 10 milliequivalent/hour. This question assesses your knowledge of safe administration practices for intravenous potassium chloride, which is a high-alert medication. The essential action is to infuse potassium chloride at a slow, controlled rate, typically no faster than 10 milliequivalent/hour, to prevent fatal cardiac dysrhythmias. Administering it as a rapid forepush can cause immediate cardiac arrest, and inadequate dilution can also be dangerous. Always remember that 4-potassium chloride must be infused slowly and never given as in forepush, as rapid infusion can be lethal due to its direct effect on cardiac conduction. Question 16. A nurse is caring for a client with a history of alcohol use disorder who is experiencing acute alcohol withdrawal. Which medication does the nurse anticipate administering to manage the withdrawal symptoms? A. Opioid analgesic. B. Benzodiazepine. C. Antipsychotic. D. Beta blocker. Answer: B. Benzodiazepine. This question tests your knowledge of pharmacologic management for acute alcohol withdrawal. The crucial clue is acute alcohol withdrawal. Benzodiazepines, such as lorazepam or diazepam, are the first-line treatment for acute alcohol withdrawal because they help reduce central nervous system hyperexcitability, thereby preventing seizures, delirium tremens, and agitation. They work by enhancing the effect of gamma-aminobutyric acid, GABA, a neurotransmitter that has a calming effect. For example, a client experiencing tremors and anxiety from withdrawal would likely receive a benzodiazepine to stabilize their symptoms. Always remember that benzodiazepines are vital for safely managing alcohol withdrawal. Question 17. A nurse is preparing to insert an indwelling urinary catheter for a male client. Which action is a priority for preventing infection? A. Don sterile gloves after opening the catheter tray. B. Inflate the balloon with sterile water before insertion. C. Cleanse the urethral meatus with an antiseptic solution using sterile technique. D. Apply lubricating jelly to the catheter tip after cleansing. Answer. C. Cleanse the urethral meatus with an antiseptic solution using sterile technique. This question assesses your understanding of infection prevention principles during catheter insertion. The keyword priority for preventing infection highlights the importance of maintaining asepsis. Thoroughly cleansing the urethral meatus with an antiseptic solution using sterile technique is the most critical step to minimize the introduction of microorganisms into the urinary tract during catheter insertion. For example, failing to adequately cleanse the area increases the risk of a catheter-associated urinary tract infection. Always remember that meticulous sterile technique during insertion is paramount to preventing infection. Question 18. A nurse is providing discharge teaching to the parents of an infant who has just had a surgical repair of a cleft lip. Which instruction should the nurse include? A. Encourage the infant to use a pacifier for comfort. B. Position the infant on their abdomen after feeding. C. Administer pain medication as prescribed to keep the infant comfortable. D. Allow the infant to cry for short periods to clear secretions. Answer. C. Administer pain medication as prescribed to keep the infant comfortable. This question tests your understanding of postoperative care for an infant following cleft lip repair. The critical instruction is to administer pain medication as prescribed to keep the infant comfortable. Managing pain effectively is crucial because uncontrolled crying can put stress on the surgical site and potentially disrupt the sutures, leading to poor healing or dehiscence. For example, anticipating pain and administering analgesics proactively helps prevent crying spells that could compromise the repair. Always prioritize pain management to ensure optimal healing and comfort after surgery. Question 19. A nurse is assessing a client admitted with acute pancreatitis. Which laboratory finding would the nurse expect to be elevated? A. Serum amylase and lipase. B. Serum glucose and calcium. C. White blood cell count and hemoglobin. D. Blood urea nitrogen and creatinine. Answer. A. Serum amylase and lipase. This question assesses your knowledge of diagnostic indicators for acute pancreatitis. The key phrase, acute pancreatitis, points to inflammation of the pancreas. The pancreas produces digestive enzymes, including amylase and lipase. When the pancreas is inflamed, these enzymes leak into the bloodstream, causing their levels to become significantly elevated. For example, an amylase level 3 times the upper limit of normal, along with a lipase level, strongly suggests pancreatitis. Remember that elevated amylase and lipase are the hallmark diagnostic indicators for acute pancreatitis. Question 20. A nurse is preparing to administer an oral medication to a client who has difficulty swallowing. Which action should the nurse take? A. Crush enteric-coated tablets and mix with applesauce. B. Offer the client a full glass of water to take with the medication. C. Position the client upright in a high Fowler's position. D. Instruct the client to tilt their head backward when swallowing. Answer. C. Position the client upright in a high Fowler's position. This question tests your understanding of safe medication administration techniques for clients with dysphagia, difficulty swallowing. Positioning the client upright in a high Fowler's position or in a chair is crucial because it uses gravity to aid swallowing and significantly reduces the risk of aspiration. The keyword difficulty swallowing is a direct clue. For example, administering medication to a client lying flat could cause the medication to enter the airway instead of the esophagus. Always prioritize client safety by ensuring proper positioning to prevent aspiration when administering oral medications to clients with swallowing difficulties. Question 21. A nurse is performing a focused assessment on a client experiencing an acute asthma exacerbation. Which assessment finding is most indicative of worsening respiratory status? A. Expiratory wheezing. B. Productive cough. C. Decreased level of consciousness. D. Report of chest tightness. Answer. C. Decreased level of consciousness. This question assesses your ability to identify critical signs of worsening respiratory distress in a client with asthma. While expiratory wheezing, productive cough, and chest tightness are common symptoms of asthma, a decreased level of consciousness is the most concerning and indicates severe hypoxemia and hypercapnia, signaling imminent respiratory failure. It suggests that the client's brain is not receiving enough oxygen, which is a life-threatening emergency. Always prioritize changes in mental status when assessing respiratory clients, as it often reflects severe physiological compromise. Question 22. A nurse is caring for a client with a new prescription for metformin. Which information should the nurse include in the client's teaching plan? A. You may experience increased thirst and urination. B. Take this medication with food to reduce gastrointestinal upset. C. This medication is usually taken before bedtime. D. You should monitor your blood glucose levels once a week. Answer. B. Take this medication with food to reduce gastrointestinal upset. This question tests your knowledge of common side effects and administration guidelines for metformin, a common medication for type 2 diabetes. The most important instruction regarding administration is to take this medication with food to reduce gastrointestinal upset. Metformin commonly causes side effects like nausea, diarrhea, and abdominal discomfort, especially when initiated. Taking it with meals helps minimize these effects and improves client adherence. For example, advising the client to take it with breakfast and dinner can make it more tolerable. Always emphasize strategies to manage common side effects to promote medication adherence. Question 23. A nurse is assessing a 4-year-old child admitted with dehydration. Which finding is the most reliable indicator of fluid status in a young child? A. Absence of tears when crying. B. Decreased urine output. C. Sunken fontanelle. D. Weight loss. Answer. D. Weight loss. This question assesses your understanding of reliable indicators of dehydration in pediatric clients, while absence of tears, decreased urine output, and sunken fontanelle in infants are signs of dehydration. Weight loss is considered the most objective and reliable indicator of fluid loss in children. Body weight changes directly reflect fluid volume changes. For example, a 1 kilogram weight loss equates to approximately 1 liter of fluid loss. Always prioritize daily weights when monitoring fluid status in children with dehydration, as it provides a quantifiable measure of fluid deficit. Question 24. A nurse is teaching a client about self-administration of insulin. Which instruction should the nurse include? A. Inject the insulin into the same site each time to ensure consistency. B. Massage the injection site vigorously after injecting the insulin. C. Rotate injection sites within the same general area. D. Inject insulin into muscle tissue for rapid absorption. Answer: C. Rotate injection sites within the same general area. This question tests your knowledge of proper insulin self-administration techniques. The key instruction is to rotate injection sites within the same general area, e.g., abdomen, thigh arm. This practice helps prevent lipodystrophy, fat tissue hypertrophy or atrophy, and promotes consistent absorption of insulin. For example, if a client always injects in the exact same spot on their abdomen, a lump might form, affecting insulin absorption. While avoiding the exact same spot, rotating within an area like the abdomen provides consistent absorption compared to rotating between different body areas daily. Always emphasize site rotation to ensure optimal insulin absorption and prevent tissue damage. Question 25. A nurse is reviewing the medication list for a client with benign prostatic hyperplasia, BPH. Which medication classification is commonly prescribed to relax smooth muscle in the prostate and bladder neck? A. Beta blockers. B. Alpha-1 adrenergic antagonists. C. Loop diuretics. D. Angiotensin-converting enzyme, ACE, inhibitors. Answer: B. Alpha-1 adrenergic antagonists. This question assesses your pharmacological knowledge related to benign prostatic hyperplasia, BPH. Alpha-1 adrenergic antagonists, also known as alpha blockers, are commonly prescribed for BPH. They work by blocking alpha-1 receptors in the smooth muscle of the prostate and bladder neck, causing relaxation and improving urine flow. For example, medications like tamsulosin, Flomax, fall into this category and are effective in alleviating BPH symptoms. Remember that these medications directly address the obstructive symptoms of BPH by relaxing the prostate muscles. Question 26. A nurse is providing care for a client with a history of seizures. The client suddenly experiences a tonic-clonic seizure. Which action should the nurse prioritize during the seizure? A. Restrain the client's limbs to prevent injury. B. Place a padded tongue blade in the client's mouth. C. Protect the client's head and ensure a patent airway. D. Administer intravenous anti-epileptic medication immediately. Answer: C. Protect the client's head and ensure a patent airway. This question assesses your priority nursing actions during a generalized tonic-clonic seizure. The most crucial actions are to protect the client's head by patting the area around it and ensuring a patent airway by turning the client to their side. These actions prevent physical injury during the seizure's motor activity and prevent aspiration of saliva or vomitus. Restraining limbs or inserting objects into the mouth can cause injury. For example, moving furniture away and placing a pillow under the head helps prevent head trauma. Always prioritize client safety and airway management during a seizure. Question 27. A nurse is caring for a client with chronic kidney disease. Which dietary modification is most important for this client? A. Increased protein intake. B. Liberal fluid intake. C. Restricted phosphorus intake. D. High sodium intake. Answer: C. Restricted phosphorus intake. This question tests your knowledge of dietary management for chronic kidney disease, CKD. The keyword most important for CKD points to managing electrolyte imbalances and metabolic waste products. Clients with CKD often have difficulty excreting phosphorus, leading to hyperphosphatemia, which can cause bone disease and calcification of blood vessels. Therefore, restricted phosphorus intake is crucial to prevent these complications. For example, advising clients to limit dairy products, nuts, and processed foods is essential. Remember that dietary restrictions are key to slowing the progression of CKD and managing its complications. Question 28. A nurse is teaching a group of parents about infant safety. Which statement indicates proper car seat safety? A. My 9-month-old can sit forward-facing in the back seat. B. The car seat harness should be snugly fit at or above the infant's shoulders. C. My infant can ride in the front seat if the airbag is turned off. D. I can place a thick blanket under my infant for extra comfort. Answer. B. The car seat harness should be snugly fit at or above the infant's shoulders. This question assesses your knowledge of safe car seat practices for infants. The correct statement is that the car seat harness should be snugly fit at or above the infant's shoulders for a rear-facing car seat. This ensures the straps properly restrain the infant in a crash. For forward-facing seats, the straps should be at or above the shoulders. Placing an infant forward-facing too early, allowing front seat riding, or using thick padding under the infant compromises safety. For example, a loose harness can allow the infant to be ejected in a crash. Always remember that proper harness placement and fit are paramount for car seat safety. Question 29. A nurse is reviewing discharge instructions for a client who underwent a cataract extraction. Which statement indicates the client understands the postoperative care? A. I should avoid bending over or lifting heavy objects. B. It's fine to rub my eye if it feels itchy. C. I can resume all my normal activities immediately. D. I should expect some clear drainage from my eye for a week. Answer. A. I should avoid bending over or lifting heavy objects. This question assesses your understanding of postoperative care following cataract extraction. The statement, I should avoid bending over or lifting heavy objects, indicates correct understanding. These activities can increase intraocular pressure, which can put strain on the surgical site and potentially lead to complications like bleeding or displacement of the intraocular lens. For example, instructing the client to get help with household chores temporarily helps prevent complications. Always emphasize avoiding activities that increase intraocular pressure after eye surgery. Question 30. A nurse is caring for a client who is experiencing hypovolemic shock. Which compensatory mechanism should the nurse expect to observe? A. Bradycardia. B. Hypertension. C. Peripheral vasodilation. D. Tachycardia. Answer. D. Tachycardia. This question tests your understanding of the body's compensatory mechanisms in response to hypovolemic shock, low blood volume. The key concept is how the body tries to maintain adequate tissue perfusion when blood volume is decreased. In hypovolemic shock, the heart rate increases tachycardia as a compensatory mechanism to pump the remaining blood more quickly and maintain cardiac output. For example, if a client is bleeding severely, their heart will beat faster to try and compensate for the lost blood volume. Always remember that an increased heart rate is a primary compensatory response to low blood volume. Question 31. A nurse is assessing a client who takes digoxin daily. The nurse notes the client's apical pulse is 52 beats per minute. Which action should the nurse take? A. Administer the digoxin as prescribed. B. Hold the digoxin and notify the healthcare provider. C. Administer a rapid-acting diuretic. D. Encourage the client to ambulate to increase heart rate. Answer. B. Hold the digoxin and notify the healthcare provider. This question assesses your knowledge of safe medication administration, specifically for digoxin. The crucial clue is the client's apical pulse of 52 beats per minute, which is below the safe threshold for administering digoxin, typically less than 60 bpm in adults. Digoxin slows the heart rate, and administering it when the pulse is already low can lead to symptomatic bradycardia or even heart block. For example, if a client's pulse is low, Giving digoxin could dangerously reduce their heart rate further. Always remember to check the apical pulse for a full minute before administering digoxin and hold the medication if the pulse is below the safe parameters. Question 32. A nurse is caring for a client with a history of peptic ulcer disease. The client reports severe abdominal pain that is relieved by eating. Which type of ulcer is the client most likely experiencing? A. Gastric ulcer. B. Duodenal ulcer. C. Esophageal ulcer. D. Stress ulcer. Answer. B. Duodenal ulcer. This question tests your ability to differentiate between types of peptic ulcers based on symptom presentation. The key clue is abdominal pain that is relieved by eating. Duodenal ulcers typically cause pain that improves with food intake because food buffers the gastric acid before it reaches the duodenum. In contrast, gastric ulcer pain often worsens with eating. For example, a client with a duodenal ulcer might describe pain that wakes them at night but feels better after a snack. Always remember that pain relief with food is a classic sign of a duodenal ulcer. Question 33. A nurse is preparing a client for a magnetic resonance imaging scan. Which information is most important for the nurse to obtain from the client? A. History of claustrophobia. B. Last oral intake. C. Presence of any metal implants or devices. D. Current medication list. Answer. C. Presence of any metal implants or devices. This question assesses your understanding of safety considerations for MRI scans. The most critical information to obtain is the presence of any metal implants or devices. MRI machines use powerful magnets that can interact with metal, causing severe injury, dislodgement of implants, like pacemakers, cochlear implants, or certain aneurysm clips, or burns. For example, a client with an unknown cerebral aneurysm clip could suffer a fatal hemorrhage if exposed to the MRI's magnetic field. Always prioritize screening for metal implants to ensure client safety before an MRI. Question 34. A nurse is providing education to a client prescribed a new medication, sublingual nitroglycerin, for angina. Which instruction is most important for the nurse to include? A. Swallow the tablet whole with a glass of water. B. Place the tablet under your tongue when you feel chest pain. C. Take one tablet every hour until your chest pain subsides. D. Store the medication in the refrigerator to prolong its shelf life. Answer. B. Place the tablet under your tongue when you feel chest pain. This question assesses your understanding of the proper administration and use of sublingual nitroglycerin for angina. The most important instruction is to place the tablet under your tongue when you feel chest pain. Sublingual administration allows rapid absorption directly into the bloodstream, providing quick relief for anginal pain. Swallowing it would render it ineffective due to first-pass metabolism, and incorrect dosing intervals could be dangerous. For example, teaching the client to let the tablet dissolve under their tongue, rather than chew or swallow it, is crucial for its effectiveness. Always emphasize the sublingual route and proper timing for nitroglycerin administration. Question 35. A nurse is providing care for an older adult client who is experiencing delirium. Which nursing intervention is most appropriate? A. Administer a sedative to promote sleep. B. Restrain the client to prevent falls. C. Provide a consistent, quiet, and well-lit environment. D. Orient the client to reality only when they ask questions. Answer. C. Provide a consistent, quiet, and well-lit environment. This question assesses your knowledge of appropriate nursing interventions for clients experiencing delirium. The most appropriate intervention is to provide a consistent, quiet, and well-lit environment. Delirium is characterized by acute confusion and fluctuating mental status, and a stable, predictable, and calm environment helps minimize disorientation and agitation. For example, keeping the room well lit can reduce shadows that might lead to misinterpretations or hallucinations. Always remember that environmental consistency and reorientation are key to managing delirium. Question 36. A nurse is preparing to administer a blood transfusion. Which client identification method is the most important to ensure client safety? A. Check the client's room number against the blood bag label. B. Ask the client to state their name and date of birth. C. Verify the client's armband identification with another registered nurse. D. Compare the blood type on the bag with the client's medical record. Answer. C. Verify the client's armband identification with another registered nurse. This question assesses your understanding of crucial safety protocols for blood transfusion. While all options are important, the most critical for client identification to prevent errors is to verify the client's armband identification with another registered nurse. This dual-check system, often called a two-person verification, significantly reduces the risk of administering blood to the wrong client, which can have fatal consequences. For example, even if the client states their name, verifying with a second nurse and cross-referencing the armband is the safest approach. Always remember that two-person verification of client identification is paramount for blood product administration. Question 37. A nurse is caring for a client with a history of chronic obstructive pulmonary disease, COPD, who is receiving oxygen therapy. Which oxygen delivery method is generally preferred to prevent carbon dioxide retention? A. Nasal cannula at 1 to 2 liters per minute. B. Non-rebreather mask at 10 to 15 liters per minute. C. Partial rebreather mask at 8 to 10 liters per minute. D. Venturi mask at a precise VO2. Answer. D. Venturi mask at a precise VO2. This question assesses your knowledge of oxygen therapy for clients with chronic obstructive pulmonary disease, COPD. The concept being tested is preventing hypercapnia, carbon dioxide retention, in COPD clients. A Venturi mask at a precise VO2 fraction of inspired oxygen is generally preferred because it delivers a specific and consistent concentration of oxygen, which is crucial for COPD clients who may rely on a hypoxic drive to breathe. For example, a Venturi mask set at 24% or 28% ensures a controlled oxygen dose, unlike nasal cannulas, which are less precise at higher flows, or rebreather masks that deliver higher, less controlled concentrations. Always remember that precise oxygen delivery is key for COPD clients to prevent worsening hypercapnia. Question 38. A nurse is assessing a client with a suspected urinary tract infection, UTI. Which symptom is most indicative of a UTI? A. Flank pain. B. Hematuria. C. Dysuria. D. Fever. Answer. C. Dysuria. This question tests your knowledge of common symptoms associated with urinary tract infections, UTIs. The keyword most indicative points to the classic and most frequently reported symptom. Dysuria, which means painful or difficult urination, is a hallmark symptom of a UTI caused by inflammation and irritation of the urethra and bladder. While flank pain can indicate pyelonephritis, kidney infection, hematuria, blood in urine, can have other causes, and fever is a systemic sign, dysuria is a direct and common symptom of a lower UTI. Always remember that dysuria is a primary indicator of a UTI. Question 39. A nurse is preparing to administer tuberculin skin test, TST. Which route of administration is appropriate for this test? A. Intramuscular, IM. B. Subcutaneous, sub-Q. C. Intradermal, ED. D. Intravenous, 4. Answer. C. Intradermal, ED. This question assesses your understanding of medication administration routes, specifically for the tuberculin skin test, TST. The TST, also known as a PPD test, is administered via the intradermal (ED) route. This means the injection is given just beneath the epidermis, forming a bleb or wheal, which allows for proper antigen-antibody reaction and subsequent reading of the skin's response. For example, the nurse uses a small needle at a 5 to 15 degree angle to create this bleb. Always remember that the intradermal route is essential for accurate TST results. Question 40. A nurse is caring for a client who is experiencing an acute asthma attack. The client's respiratory rate is 32 breaths/min, and audible wheezes are noted. Which medication should the nurse anticipate administering first? A. Oral prednisone. B. Inhaled albuterol. C. Intravenous magnesium sulfate. D. Subcutaneous epinephrine. Answer: B. Inhaled albuterol. This question assesses your knowledge of the immediate management of an acute asthma attack. The key clue is acute asthma attack and the symptoms of rapid breathing and wheezing. Inhaled albuterol is a short-acting beta agonist, SABA, which is the first-line and most rapid-acting bronchodilator used to relieve acute bronchospasm and improve airflow. For example, this medication quickly relaxes the smooth muscles of the airways, opening them up. Always remember that for acute asthma exacerbations, a SABA like albuterol provides the fastest relief of symptoms. Question 41. A nurse is providing education to a pregnant client about avoiding neural tube defects. Which dietary recommendation should the nurse emphasize? A. Increase calcium intake. B. Ensure adequate iron intake. C. Supplement with folic acid. D. Limit protein consumption. Answer: C. Supplement with folic acid. This question tests your knowledge of essential prenatal nutrition, specifically for preventing neural tube defects, NTDs. The key recommendation is to supplement with folic acid. Folic acid, a B vitamin, is crucial for the proper development of the neural tube during early pregnancy. Adequate intake, especially before conception and throughout the first trimester, significantly reduces the risk of NTDs like spina bifida. For example, advising the client to take a prenatal vitamin containing 400 to 800 micrograms of folic acid daily is vital. Always remember that folic acid is paramount for preventing neural tube defects. Question 42. A nurse is preparing to administer total parenteral nutrition, TPN, to a client. Which action is most important for the nurse to take to prevent complications? A. Administer through a peripheral intravenous line. B. Monitor blood glucose levels regularly. C. Change the TPN bag every 48 hours. D. Infuse rapidly to meet nutritional needs. Answer: B. Monitor blood glucose levels regularly. This question assesses your understanding of crucial safety measures when administering total parenteral nutrition, TPN. The most important action to prevent complications is to monitor blood glucose levels regularly. TPN solutions are high in dextrose, glucose, and can cause hyperglycemia, even in clients without a history of diabetes, leading to complications like osmotic diuresis and fluid shifts. For example, checking blood glucose every 4 to 6 hours is standard practice to adjust insulin doses as needed. Always remember that meticulous glucose monitoring is essential for safe TPN administration due to its high glucose content. Question 43. A nurse is assessing a client with a suspected fractured femur. Which finding is the most classic sign of a femoral fracture? A. Ecchymosis around the knee. B. Shortening and external rotation of the affected leg. C. Pain with movement of the hip. D. Swelling of the foot on the affected side. Answer: B. Shortening and external rotation of the affected leg. This question assesses your ability to identify classic signs of a femoral fracture. The most classic and indicative sign of a fractured femur, particularly a hip fracture, is shortening and external rotation of the affected leg. This occurs due to the muscle spasms pulling the fractured bone fragments out of alignment. While pain, ecchymosis, and swelling can be present, the specific deformity of shortening and external rotation strongly suggests a fracture. For example, if a client falls and their leg appears shorter and turned outwards, a femoral fracture is highly likely. Always remember these specific positional changes as strong indicators of a femoral fracture. Question 44. A nurse is teaching a client about management of GERD, gastroesophageal reflux disease. Which dietary modification should the nurse recommend? A. Eat large meals before bedtime. B. Increase intake of spicy foods. C. Avoid caffeine and chocolate. D. Drink carbonated beverages with meals. Answer. C. Avoid caffeine and chocolate. This question tests your knowledge of dietary management for gastroesophageal reflux disease, GERD. The key is to recommend avoiding substances that relax the lower esophageal sphincter, LES, or increase gastric acid production. Avoiding caffeine and chocolate is crucial because both can weaken the LES, allowing stomach acid to reflux into the esophagus and worsen GERD symptoms. For example, suggesting herbal tea instead of coffee or plain unsweetened desserts can help manage symptoms. Always remember to advise clients with GERD to identify and eliminate trigger foods that exacerbate their reflux. Question 45. A nurse is caring for a client who is receiving intravenous fluids. The nurse notes swelling, pain, and coolness at the fore-insertion site. Which complication does the nurse suspect? A. Phlebitis. B. Infiltration. C. Cellulitis. D. Fluid overload. Answer. B. Infiltration. This question assesses your ability to identify common complications of intravenous therapy. The cluster of symptoms, swelling, pain, and coolness at the fore-insertion site, is classic for infiltration. Infiltration occurs when the intravenous fluid leaks out of the vein and into the surrounding subcutaneous tissue. For example, if you feel a puffy, cool area around the foresite, it's likely infiltrated. Always remember that coolness and swelling are hallmark signs of infiltration, indicating the need to discontinue the fore immediately and restart it in another location. Question 46. A nurse is assessing a client who has hyperthyroidism. Which clinical manifestation should the nurse expect to find? A. Weight gain. B. Bradycardia. C. Heat intolerance. D. Constipation. Answer. C. Heat intolerance. This question tests your knowledge of the clinical manifestations of hyperthyroidism. Hyperthyroidism, or an overactive thyroid gland, leads to an increased metabolic rate. The keyword hyperthyroidism should prompt thoughts of too much activity. Heat intolerance is a classic symptom because the body is producing excess heat due to the elevated metabolism. For example, a client with hyperthyroidism might feel uncomfortably warm in a room where others are comfortable, often sweating excessively. Always remember that hyperthyroidism speeds things up, including metabolism and heat production. Question 47. A nurse is teaching a client about home management of chronic venous insufficiency. Which instruction is most important for the nurse to include? A. Elevate the legs above the heart while resting. B. Stand for prolonged periods throughout the day. C. Apply cold compresses to swollen ankles. D. Wear restrictive clothing around the legs. Answer. A. Elevate the legs above the heart while resting. This question assesses your understanding of effective management strategies for chronic venous insufficiency, CVI. The most important instruction is to elevate the legs above the heart while resting. This action uses gravity to promote venous return, reducing pooling of blood in the lower extremities, thereby alleviating swelling and discomfort associated with CVI. For example, advising the client to elevate their legs for 15 to 30 minutes several times a day can significantly improve symptoms. Always remember that elevation is key to improving venous return and reducing edema in CVI. Question 48. A nurse is caring for a client with a new diagnosis of hypertension. Which lifestyle modification should the nurse recommend first? A. Begin a vigorous exercise program daily. B. Drastically reduce all sodium intake to 0. C. Implement the dietary approaches to stop hypertension, diet. D. Limit fluid intake to 1 liter per day. Answer. C. Implement the dietary approaches to stop hypertension, diet. This question tests your knowledge of initial lifestyle modifications for managing hypertension. While exercise and sodium reduction are important, implementing the dietary approaches to stop hypertension, diet, is the most comprehensive and evidence-based first dietary recommendation. The diet emphasizes fruits, vegetables, whole grains, and lean proteins while limiting saturated fat, cholesterol, and sodium, providing a balanced approach to lower blood pressure. For example, instead of just saying eat less salt, the diet provides a clear, actionable eating plan. Always remember that the diet is a well-established and effective initial strategy for managing hypertension. Question 49. A nurse is preparing a client for discharge after an acute myocardial infarction. Which statement by the client indicates a need for further teaching? A. I will take my nitroglycerin if I experience chest pain, up to 3 doses, 5 minutes apart. B. I should avoid strenuous activities like heavy lifting for several weeks. C. I can start smoking again since my heart attack is over. D. I will monitor my blood pressure and heart rate regularly. Answer. C. I can start smoking again since my heart attack is over. This question assesses your ability to identify misconceptions in client education, particularly regarding post-myocardial infarction. The statement, I can start smoking again since my heart attack is over, clearly indicates a need for further teaching. Smoking cessation is one of the most critical interventions after an MI to prevent future cardiac events, as smoking significantly increases the risk of heart disease progression. For example, emphasizing that smoking damages blood vessels and reduces oxygen supply to the heart is crucial. Always stress that quitting smoking is vital for long-term cardiac health after an MI. Question 50. A nurse is caring for a client who is NPO, nothing by mouth, and has a prescription for an oral medication. Which action should the nurse take? A. Administer the medication with a small sip of water. B. Notify the healthcare provider about the NPO status. C. Crush the medication and mix it with a small amount of ice chips. D. Hold the medication until the client is no longer NPO. Answer. B. Notify the healthcare provider about the NPO status. This question tests your understanding of medication administration rules, especially concerning NPO status. When a client is NPO, nothing by mouth, and has a prescription for an oral medication, the nurse must notify the healthcare provider. The provider needs to decide if the medication should be given by an alternative route, held, or if the NPO status can be temporarily lifted. Administering an oral medication to an NPO client without a specific order violates the NPO status and can lead to aspiration or interfere with scheduled procedures. For example, if a client is NPO for surgery, giving them an oral medication could delay the procedure. Always communicate changes or conflicts in orders with the healthcare provider.